Hello, this is Dr. Haroon Ilyas, and in this video we will be talking about the foot infection of Dustin Poirier. If you want to know about the injuries athletes suffer off and on the field, consider subscribing to this channel because I will be breaking down a lot of sports related injuries on this channel. So, couple of days ago, this horrific picture of Dustin Poirier's feet was circulating among the MMA community, which basically is a cellulitis caused by staph aureus, and Dustin Poriier was forced to admit in the hospital and receive some IV antibiotics due to this staph infection. So now I will be breaking down this infection of Dustin Poriier. So it all started with this picture, and you can see here a bit of swelling along with a puncture wound or a pustule right below the fifth finger, and after a few days Dustin Poriier shared this image where the redness and swelling has significantly increased and the puncture wound or the pustule was spilling some yellowish discharge. And reports claim that Poriier has gotten staph infection, and one of its manifestation in the skin is cellulitis, which we can see in this picture. Staph infection is caused by a lot of staphylococci bacteria, but the one causing trouble to Poriier is staph aureus. Staph aureus is present on our skin and nostrils, and with any break in the continuity of skin or mucous membrane, it can spread to the surrounding tissue, and particularly it is more common in people having close physical contact such as boxing, Brazilian jiu-jitsu, wrestling, and people working out in the gym and exchanging towels. In the case of Dustin, you can see a wound or a pustule right beneath the fifth finger that could have been a source of spread for staph aureus, and the swelling you can see is mainly due to the hypervascularity of this area. That means dilation of blood vessels so that more and more blood can come into this area, and with blood comes those products, that is antibodies, that can attack the staph aureus and can get rid of it. Another cause of swelling is the leakage of fluid from the capillaries, and if this staph aureus infection cannot be treated properly, it could spread into the underlying bone and can cause osteomyelitis. It can spread in the bloodstream causing septicemia, and that is a life-threatening condition. Earlier he was treated at home with oral antibiotics, and obviously this infection seemed not to be controlled by oral antibiotics. He was then admitted in the hospital for IV antibiotics, and that's basically the treatment regime for any infection. First oral antibiotics were given, then if it is not controlled by any oral antibiotics, IV antibiotics are used so that these antibiotics can eliminate the organism out of our system. The line you can see in this picture is marked by the doctors to know about the spread of infection and the effectivity of IV antibiotics. So this is it from this video. If you like the content related to sports injuries, consider subscribing to this channel. Thanks for watching.